Good morning, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair of the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team working in hard-hit communities in Georgia to provide vaccinations and testing, and I host the Emory COVID-19 videos where we cover important topics about the COVID-19 pandemic. Today, I am pleased to be joined by Dr. Denise Jamieson. Dr. Jamieson is professor and chair of the Emory Department of Gynecology and Obstetrics and chief of OBGYN for Emory Healthcare. Before joining Emory, she served in a variety of leadership roles at the CDC, including as medical care task force lead for the Ebola response in 2014 and as incident commander for the CDC's response to Zika in 2016 to 2017. Good morning, Dr. Jamieson, and thank you for joining me today.
Good morning, glad to be here.
Thank you. We're going to be talking about safety of COVID-19 vaccines in pregnant women and those who may want to become pregnant in the future, as well as side effects of COVID-19 on pregnant women and their fetuses. First, let's go over some COVID-19 numbers for October 7th. This week, we reached more than 700,000 deaths from COVID-19 in the United States. This is by far the largest burden of deaths in the world. In fact, this is 15% of the world's deaths from COVID-19 in just 4.2% of the world's population. Thankfully, daily death reports have started to slowly decline, but it remains common for more than 1,800 deaths to occur in a day. The US is quickly approaching 44 million cases of COVID-19, though for the last 3 weeks, the number of new cases has been falling. Still, we are averaging more than 100,000 new cases a day, primarily among those who are unvaccinated. While 96% of counties in the United States are areas of high or substantial transmission, and new COVID-19 cases remain highest in several states. Alaska has, by far, the highest cases per capita in the country right now. The spike there has overwhelmed the state's medical system and forced doctors to make decisions about who receives the highest levels of care. Daily case reports are flat or falling in 40 states, but hotspots have emerged in the northern third of the country. Cases continue to climb in Montana and Idaho, and parts of Michigan's Upper Peninsula are also reporting their highest caseloads of the pandemic. Through October 6th, there have been more than 120,000 confirmed cases of COVID-19 in women who are pregnant, including more than 22,000 people who've been hospitalized and 171 deaths. 22 of these deaths occurred in the month of August, and 10 have occurred in just the past 10 days. Cases of COVID-19 in symptomatic pregnant women have a 2 times increased risk of admission into intensive care and a 70% risk of death. This is what we're going to be talking about with Dr. Jamieson today. So let's start with, what have we learned in totality in our first 18 months of this pandemic of women who are pregnant and the effects of COVID-19 on pregnancy?
I think we've learned a lot in 2 major areas. One is what effects COVID has in pregnancy, and the second area is the safety of the vaccine in pregnancy. So we now know that pregnancy is a risk factor for severe disease. Pregnant persons are more likely to be hospitalized, more likely to require ICU or intensive care unit care, and more likely to die if infected with COVID. We also now know that intrauterine transmission, that is transmission of COVID from the mother to her fetus, is possible, although luckily it's fairly rare. But we also have accumulating evidence about adverse pregnancy outcomes. Persons who are infected with COVID have an increased risk of preeclampsia, an increased risk of preterm birth, and an increased risk of stillbirth. And these risks are particularly notable among those who have severe disease. So that's sort of what we've learned about COVID and pregnancy. The other piece that we're continue to learn a lot about, is the safety of COVID vaccines in pregnancy. We now know that over 160,000 pregnant persons have been vaccinated and have registered for VSafe, CDC's surveillance system for pregnant persons. And there have been no safety signals in this surveillance system or any of the other many surveillance systems in the country or in the world.
That is very good to hear as far as the safety that we're learning about. Let's talk for a moment just about the COVID-19 effect on the fetus and the newborns, because that's some of the newer information that's been coming out.
So most viruses can be transmitted during pregnancy. The question is how often this occurs. So it was no surprise that there were case reports of transmission from pregnant persons to their fetuses. Luckily, in the case of COVID, this seems to be relatively rare for a variety of reasons. You don't tend to get the high levels of virus circulating in the bloodstream. The placenta doesn't seem to express high levels of the factors that help that facilitate transmission. And so luckily, transmission to the fetus during pregnancy seems to be relatively rare. The other piece of good news is that there's no evidence of direct effects of the virus causing birth defects. So with viruses like rubella and more recently Zika, we know that the virus can infect fetuses and cause this pattern of birth defects. And that luckily doesn't happen with COVID. But unfortunately, COVID does have indirect effects on the fetus, and particularly among pregnant persons who are severely ill, they tend to have worse outcomes. There's an increased risk of preeclampsia in the mother. There is an increased risk of preterm birth. There's an increased risk of stillbirth and increased risk of low birth weight among pregnant persons infected with COVID.
So according to CDC data, only 31% of pregnant people have been vaccinated against COVID-19, and vaccination rates vary markedly by race and ethnicity. So vaccination coverage is highest among Asian people who are pregnant at about 46%, lower among Hispanic Latino pregnant people at about 25%, and lowest among Black people who are pregnant at 16%. So we've got a lot of variation there and unfortunately very low rates. Why is COVID-19 vaccination so important for pregnant people?
Well, I would argue that COVID vaccination is important for all people, not just pregnant people, but it's particularly important if you're pregnant. And that's because, as I mentioned previously, in pregnancy, the risks are increased. There's an increased risk for the pregnant person, an increased risk of severe disease, and then risks for the baby as well.
So on September 29th, the CDC issued an urgent health advisory to increase COVID-19 vaccination among people who are pregnant. As we've already mentioned, the rates are very low. Recently, pregnancy, including those who are lactating, were listed in this advisory, and includes those who intend to become pregnant now or are trying to become pregnant in the future to prevent serious illness, deaths, and adverse pregnancy outcomes. So in addition to the health advisory from the CDC, the American College of Obstetricians and Gynecologists, or known as ACOG, recently put out some new recommendations to further support COVID-19 vaccination in pregnant people. Can you tell us more about these recent announcements?
Yes, so things have been rapidly evolving throughout the pandemic. I mean, we've learned so much about COVID since the beginning of the pandemic. We have there's been vaccines have been developed incredibly rapidly. And so this has resulted in a need for professional organizations and the CDC to adjust their language and recommendations based on the emerging evidence. And what happened recently was at the end of July, ACOG strengthened their language, American College of OBGYNs, to strongly recommend vaccine for pregnant persons. Previously, when the vaccines were first available, the language was much softer. It talked about pregnant persons should consider, the vaccine should not be withheld in pregnancy, but really didn't have a strong recommendation. Within a couple of weeks, the CDC also followed suit and strengthened their recommendation as well. So both ACOG and the CDC and several other professional organizations now strongly recommend the vaccine for pregnant persons.
I think that really strong language, I hope, is getting a lot of attention. Since pregnant persons were excluded from the vaccine trials, what are we learning about the safety of the vaccine during pregnancy? Because that is so incredibly top of mind for people who are going to become pregnant or are pregnant.
It's amazing how much we've learned about the safety of the vaccines since they were first available. When they were first available, we had really very little information to go on. And now we have very rapidly accumulating data. So if you look on the CDC's website at the VSafe data, you can see that there are over 160,000 pregnant persons who have registered in VSafe and have been vaccinated for COVID. And there are over 5,000 pregnant persons who are enrolled in a birth registry, and both them and their infants will be followed. And that's just one example of one surveillance system. Other countries are collecting information, and there are other surveillance systems in the United States. And no safety signals have evolved. Most notably, there's always concern about vaccines and the risk of miscarriage. And we have good data now, good information that the vaccines do not cause an increase, are not associated with an increased risk of miscarriage or spontaneous abortion.
What other vaccinations are given to pregnant people safely? Because this is not new.
This is definitely not new. So we routinely recommend that all pregnant women receive Tdap, tetanus, diphtheria, and pertussis vaccination, as well as influenza during pregnancy. And one thing that many people don't realize is how long we've been recommending influenza vaccination in pregnancy. Influenza vaccine was first recommended by the Surgeon General in 1960 for pregnant persons. And so we've got decades of information about vaccines in pregnancy. Most other vaccines are also considered safe in pregnancy. We generally avoid live vaccines because there's this risk and concern about transmitting the virus to the fetus. But even in some circumstances, live vaccines are given. For example, smallpox vaccine is a live vaccine. But if a pregnant person is exposed to smallpox, you would counsel them on the risks and benefits of receiving the vaccine. And in many cases, you would still recommend receiving the vaccine.
So should people get the COVID-19 vaccine if they are considering pregnancy before they get pregnant, or do we want to wait until after the person is pregnant?
The best time to get vaccinated is as soon as possible, so not to delay. So for persons who are considering pregnancy, we would recommend that you have a visit with your OBGYN or other care provider and really plan for the pregnancy. And part of that planning would be to ensure that all your vaccinations, including COVID, are up to date. And this ensures that you will be protected, maximally protected prior to pregnancy.
How about all the people who are pregnant live with or work with? Is it important for them to also get vaccinated?
It is. The vaccination is an interesting concept because you're not only protecting yourself, but you're protecting those around you by decreasing the risks of community transmission. And then very specifically, if you're planning to have a baby, once that baby is born, that infant is more vulnerable to severe disease compared with older children, and they're too young to get vaccinated. And so it's really important that those around the baby who are going to be interacting with the baby are also protected against influenza and Tdap, pertussis, and importantly, COVID.
And I think that the point you made a moment ago about not only are you protecting the pregnant person or potentially pregnant person and the baby, but you're helping drive down transmission, which will ultimately get us out of this pandemic further, which is incredibly important. There are a lot of myths and inaccuracies about the COVID-19 vaccine that are keeping some pregnant people and those who want to become pregnant from seeking the vaccines. Can you help us debunk these myths and inaccuracies?
The number one myth that I hear is that the COVID vaccine causes infertility. And this has been a myth that has been circulating almost since the beginning of the pandemic. This started on social media with a scientifically inaccurate posting about the similarities between a placental protein and a COVID protein. And this was posted by a person who also made very inaccurate claims about COVID. Just to give you an example, he posted, "There is nothing frightening about COVID, just a common and garden variety virus to which the world overreacted." This person is no longer posting on social media, but this myth has lived on despite any credible scientific evidence of its accuracy. And I think it's really, unfortunately, a testament to the power of social media in propagating harmful myths.
It's really remarkable the number of people that I hear who are interested in fertility in their future who have heard that. And so the circulation of that has really been incredibly dangerous and has caused a lot of harm. Are there any other myths or inaccuracies beyond that one that you have continued to hear?
There is a lot of talk about miscarriage and the risks of miscarriage. And as I mentioned previously, that we now luckily have good, solid scientific information from a variety of sources that COVID vaccinations are not associated with an increased risk of spontaneous abortion or miscarriage. This has been an ongoing concern, for example, with influenza as well. And I think we now can say that I know of no vaccines that cause an increased risk in miscarriage. I think the other one that I've heard a lot about, which I think still needs to be sorted out, is that COVID vaccines cause a change in menstrual patterns. And then people worry, if you have irregular menses, are you going to have an increased risk of infertility? Menses is an interesting thing in that it's affected by so many things, chronic diseases, infections, weight gain and loss, stress. And in fact, I just saw a report yesterday about how a large proportion of women reported change in menses with the COVID lockdowns. And so I think it's very hard to sort out. And in order to adequately study menses, you really have to have people keep track of their bleeding patterns in a daily diary form for many months to be able to sort this out. And luckily, the federal government is now funding studies to look at this more carefully. But as an extension of this question, I've also heard things like, can you have decreased fertility or change in your menses from standing next to a person who's been vaccinated? And of course, the components of the vaccine don't leave the body and can't affect someone standing close to a person who's been vaccinated.
I've seen some of that also circulating on social media as well. So as we end here this morning, Dr. Jamieson, what would be your message to pregnant people who are still undecided about getting the COVID-19 vaccine at this point?
As an obstetrician, I can understand the reluctance of people to take medications or receive injections during pregnancy. It's a time when pregnant people want to do everything possible to protect their baby, and they make sacrifices in pregnancy. People give up their, coffee. They decrease their caffeine intake. They eat healthier. They avoid certain foods. They avoid over-the-counter medications, and they really want to do everything possible for their baby. And I think it's really important to realize that not getting vaccinated has important risks, that there are risks of not doing anything. We're living in an unprecedented time. There are more deaths now from COVID than the 1918 influenza pandemic. And there are places, like I just read in Alabama, where deaths exceeded births for the first time in 2020. This has never happened before in the history of the state. And so there are real risks of not getting vaccinated. And so to protect yourself and to protect your baby, get vaccinated and keep the conversation open. Even if you think you've decided not to get vaccinated, keep talking about it with your provider, with your friends, with community members, because it's one of the most important decisions you can make about your pregnancy during this pandemic.
Thank you so much, Dr. Jamieson. I really, with you, urge everyone to find their way to vaccination. The vaccination rates among people who are pregnant is woefully low. And we've heard today from Dr. Jamieson some really credible information and some debunking of inaccurate information about why this is so incredibly important for both the mom, the person who is pregnant, and the fetus, and for all of those who are around the pregnant person to get vaccinated as well. We hope you will take this to heart. Thank you, Dr. Jamieson, for joining me this morning.
Thank you.